Hey everybody, it's Peggy Hasenauer from the Kovler Diabetes Center. As many of you have seen, we've done a tremendous amount of videos over the last couple of weeks interviewing wonderful patients, staff, physicians, and we've also done a whole series on social media and Instagram called Where Are They Now? So Where Are They Now? We have the wonderful Ashley Cohen with us. Hey Ashley.
Hi.
Ashley, we're thrilled to have you with us. We've known you for a long time. Ashley was a nurse with us for some time and has been on this incredible journey in life and in her career that I thought would be really cool for her to share. So, Ashley, tell us a little bit about what your role was with us at Kovler and where you've gone since.
Yeah, great. Thank you for having me here. I love
Of
being a
course.
part of the Kovler family.
Yeah.
So I started off with Kovler back, I think it was in 2013, actually. Started off as a lab assistant with Dr. Lou Phillipson, doing some basic research stuff, and then slowly transitioned while continuing to work at the medical center next door into the clinical research department, working with Gail and everybody over there on TrialNet and some of the other studies that we've got going over at Kovler that everybody's really familiar with.
Hmm.
Really enjoyed my time there. Got to do a lot of the clinical trials work over in the research center, but also a lot of the calling folks for Kovler and sort of making the day-to-day of clinical trials happen.
Cool. And tell me then what made you decide to take the leap and transition to medical school, and tell us where you're at and where you are in your medical school training.
Yeah, so I'm a third year medical student at Chicago Medical School. I, somewhere a couple of years into nursing, realized that I was becoming a pain in everybody's butt sort of about the things that I was curious about, and they were a little bit sort of beyond what my scope was. I was a little overeager, I'll admit to. So I don't know how better to put that, but so I don't, I wanted a little bit more autonomy.
Hmm.
I wanted to be that person making decisions for better or worse. That was part of my personality, and I decided to run with it. So that led me to apply to medical school. I got accepted in 2017, and now I'm in my third year.
Amazing. So you're finishing up your third year. And how does that look for you in this COVID crisis we're in, where there's shelter in place? What sorts of opportunities or education are you receiving in these last months of your third year that are maybe different or unique than what they would have been?
Yeah, it's been really hard actually for a lot of medical students. We, in March, early March, were sort of displaced from our rotations, understandably so.
Sure.
Hospitals needed to focus on the acute problem, and our education needed to take a backseat out of necessity, which we all completely understood. But that left a lot of us sort of with idle hands. And, I think health professions students across the board are not a group that do well with free time. Um, so a lot of us were just sort of waiting, and we continue to wait as sort of the governing bodies are deciding how to make changes to what fourth year process will look like, how applications are going to look in the future for our class, how away rotations, which are sort of a critical part of applications for us, will look over the summer. Everything has sort of been put on pause. There's no definite answers at this point from almost any governing body, but it left us with a lot of time to sort of sort out ourselves and what to do. Yeah.
I think that's really valuable in terms of the point that you made with regard to many of us who are very busy with our home lives and with our families. We are often in a position where we are busy nonstop, or we feel like we're giving, giving, giving. And we've all, I think, in a good way, slowed down a little bit to try to figure out how to better take care of ourselves, how to shift our focus. And some of us are left with some gaps. So tell me what you've been working on right now in your free time. I see a lot of boxes around you, so I'm trying to
Yeah.
figure out, have
I've
you
been
have you hit have you hit Hobby Lobby too hard, or what is that? What's going on?
That would be a fun thing to have been doing with my time. So what happened at the start of this was I actually was contacted by some students at Northwestern. It started off as a group of about 10 medical students from across the schools of Chicago. So there are 7 medical schools in Chicago that have all banded together. So U Chicago, Loyola, the Northwestern, Midwestern, us, Rush, us being Chicago Medical School, and some others, even including like St. George's in the Caribbean. So we all came together. We were like, all right, let's do something with this time. Let's help these people who are our mentors that we're seeing struggle. I mean, literally 4 days before we met, we had been learning from these people on the job. So we wanted to help. We wanted to put our time to use. And what we decided to do was to come up with a strategy, which took about 2 days to do, to solicit and get PPE, reclaim PPE from the public. So the guy down the
Wow.
street who ordered some N95s from Amazon a month ago, we want to get those and get them into hospitals. And we did that successfully. Somebody locally started a crowdfunding, like a GoFundMe page, where he intended to donate to us. That also helped our efforts, and sort of this new window opened where we were able to purchase PPE as well. We, from that point on, just grew our organization. We're now somewhere in the neighborhood of 700 volunteers. We've expanded beyond medical students to also health profession students, undergraduate
Wow.
students. The Columbia Fashion School is helping us and cranking out hand-sewn masks. The Illinois PPE Network is helping us. They're a group of makers and 3D printers across the state.
Wow.
Um, 2 local manufacturing businesses have helped us. Boston Scientific partnered with us to distribute face shields. Amazon helped deliver them. It's been absolutely incredible to see what Chicagoland will do when under stress.
Well, and we have so much knowledge here and so much experience and so many people who care. And we're lucky enough that in the Chicago area, much like other major cities, we have a lot of medical centers. So a program or a concept that you created with a few others has really turned into something much larger. Do you have a website? How do people
We,
donate? Like, how does that work?
Yeah, so it's called Get Me PPE Chicago, and getmepppechicago.org will link to our website. Our GoFundMe is on there, and then for those we know financial times are hard for everybody. So even for those who can't maybe donate, what we ask them to do is just share it with 5 or 10 friends, because even getting the word out there means that maybe some folks who have some PPE laying around didn't think to donate it, didn't know where to donate it, will contact us. The other benefit is that on our website, there's also a form for hospitals or facilities of any type for healthcare to reach out to us and let us know that they have a need. We proactively call institutions, so hospitals, skilled nursing facilities, long-term acute care, mental health facilities, all of the above. We proactively call them, especially when we see that they have a high COVID burden, to assess their need and see what we can offer. But on top of that, we're welcome, and we welcome folks telling us that they have a need so that we can help address it.
So this is amazing. So are you set up as an official nonprofit? There wasn't time for you to be set up as a nonprofit. So but you're volunteer led, right? So
Mm-hmm.
donations come in and you're able to purchase PPE. Is that right? What are your purchasing mechanisms given the fact that there's been such a shortage?
Yeah, so we got very lucky. Part of this networking, we were able to connect with different people who had connections in China through other routes. There's a lot of people in the United States who there are opportunists in the world who purchase bulk of PPE ahead of time, anticipating that they could mark up and sell it. So if that's the cheapest thing we can get, and we can get it fast, and we can get it on to healthcare providers, we've done that.
Amazing.
Um, yeah, so we've
I
found
think
our
I
ways.
Well, I think that you've always been so collegial, Ashley. You've always partnered so beautifully with us. We've known you now for so long. And I am just amazed and astounded by how your career and your life has grown. You're recently married, you will be done with medical school in a year, and you always find time for the extra. And that's what we have always loved about you and about your energy is that you always find time to do extra, to do more, to be more. And boy, are you making a difference. Is there anything else you'd like to share with our audience today about this project or about the work that you're doing? Because um, you really have made a difference and we want you to continue to make a difference. So what can we do to help you in terms of sharing messaging?
I think just if you know somebody who might have PPE, or if you can just share the word about what we're doing at Get Me PPE, we would greatly appreciate it. I think in particular for Kovler, the thing that draws my attention, my heart always goes back to diabetes. That's sort of where I grew up in medicine, right? With Kovler, this impacts everybody across the board. So if that's our type 1 diabetic who can't get let's say your elderly person with diabetes, whether it's type 1 or type 2, you know, they are dependent on those carbs throughout the day, right? Like, you need it timed and you need space, but maybe it's not so easy to get to the grocery store anymore, or to get what you need. Getting to the pharmacy to get insulin is not always the easiest thing right now, or the safest thing for somebody who might be immunocompromised. So we've partnered with groups to try to get food deliveries out. We are making sure that folks on a local level are able to get things like the alcohol swabs, or if we need to help them find lancets, things like that. So, I mean, I think that just is illustrative of the fact that this is touching people across the board, regardless of sort of their background situation. And, you know, we're here to help everybody as best we can.
Well, I think what's so interesting about PPE is that it's really protective equipment for the healthcare provider, but also in some ways to protect the patient. And we often forget about the providers, the physicians that are out there taking care of patients, and the nurses and other healthcare providers who have risk factors themselves, right? Have diabetes themselves, have hypertension themselves, have asthma. And what can we do to band together to not only support and help our patients, but also help and support the healthcare workers that are on the front lines to help them be better protected against the virus? And I think that's what you're doing, and what a positive, amazing way to give back, Ashley. And we can't thank you enough for being with us today.
Thank you for having me. I
Of
just
course.
continue to be grateful to be part of the Kovler family.
Well, we're always happy to have you. There will be more discussions with you, Ashley. There's so many interesting different topics I want to talk to you about. And I think that we'll be doing a part two soon to talk about not only this work, but the amazing work that you're doing in medical school and beyond. So thanks again, and have a great day.
Thank you, you too.
No problem. See ya.